Why Bifidobacterium longum is getting attention. What if one tiny probiotic species could help us understand the connection between digestion, the immune system, stress, sleep, and the gut microbiome? Today, we are talking about Bifidobacterium longum, one of the most important and widely researched probiotic bacteria found in the human gut. If you have ever searched for best probiotic for gut health, probiotic for IBS, probiotic for bloating, gut-brain axis probiotic, or Bifidobacterium longum benefits, this video will help you understand what the science actually says. Bifidobacterium longum is not a magic pill. It is not a cure for every digestive problem, but it is one of the probiotic species that appears again and again in microbiome research, especially when scientists study digestive comfort, bowel regularity, gut barrier support, immune balance, and even the relationship between the gut and the brain. The most important thing to understand from the beginning is this: not every Bifidobacterium longum supplement is the same. In probiotic science, the strain matters. A strain is like the exact model number of the bacteria. Two products may both say Bifidobacterium longum, but one may contain B. longum 35624, another may contain B. longum BB536, another may contain B. longum 1714, and another may contain a completely different strain. These strains can behave differently in the body. So in this video, we will explain what Bifidobacterium longum is, how it may support the gut microbiome, why some people connect it with IBS and bloating, how it may influence the gut-brain axis, what the research says about mood and sleep, and how to choose a probiotic label wisely. This video is for educational purposes only. It is not medical advice, and it is not a replacement for your doctor, dietitian, pharmacist, or healthcare provider. But by the end, you will have a much clearer understanding of how to think about Bifidobacterium longum in a realistic, evidence-based way. What is Bifidobacterium longum? Bifidobacterium longum is a beneficial bacterial species that naturally lives in the human gastrointestinal tract. It belongs to the Bifidobacterium genus, a group of bacteria commonly associated with a healthy gut microbiome. Bifidobacteria are especially important in early life. In many breastfed infants, Bifidobacteria can become dominant members of the gut microbiome. This is partly because some Bifidobacteria are very good at using special carbohydrates found in human milk, called human milk oligosaccharides, or HMOs. These compounds are not digested by the baby in the same way as normal sugar. Instead, they help feed selected beneficial microbes. As we grow older, the microbiome becomes more diverse. Bifidobacterium levels may change depending on diet, age, lifestyle, antibiotic exposure, stress, illness, and many other factors. In adults, Bifidobacterium longum is still considered one of the important beneficial gut microbes, especially because of its ability to interact with fibers, produce helpful metabolites, and communicate with the immune system. Bifidobacterium longum is considered a friendly or beneficial bacterium because it can support a balanced gut environment. It may help break down certain carbohydrates, contribute to the production of short-chain fatty acids through microbiome cross-feeding, support the intestinal barrier, and help maintain microbial balance. But again, we need to be careful with language. When we say Bifidobacterium longum may support gut health, that does not mean every product with this name will produce the same effect in every person. The effect depends on the strain, dose, product quality, duration, diet, and the individual person's microbiome. A good way to think about Bifidobacterium longum is this: it is not a random supplement trend. It is a naturally occurring gut microbe with serious scientific interest behind it. But the best results come when we understand it as part of a bigger gut health strategy, including fiber, diverse plant foods, sleep, stress management, and appropriate medical guidance when symptoms are persistent. Why the strain matters. One of the biggest mistakes people make with probiotics is assuming that all probiotics do the same thing. This is not true. A probiotic name usually has 3 levels. First, the genus, for example, Bifidobacterium. Second, the species, for example, longum. Third, the strain, for example, 35624, BB536, NCC3001, or 1714. The strain is extremely important because clinical studies are usually performed on specific strains, not on every strain in the species. For example, if a study shows that Bifidobacterium longum 35624 may help certain IBS symptoms, that does not automatically mean that every Bifidobacterium longum supplement will do the same thing. If a study examines Bifidobacterium longum 1714 for stress or sleep, that result belongs mainly to that strain and that study context. This is why a high-quality probiotic label should ideally show the full name, genus, species, and strain. If a label only says Bifidobacterium longum without a strain code, it may still be useful, but it is harder to connect that product to specific human research. Another factor is CFU, which stands for colony-forming units. This tells you how many live microbes are expected in the product, but higher CFU is not always better. A product with a clinically studied strain and a realistic dose may be more meaningful than a random high CFU product with vague labeling. Also, look for whether the CFU count is guaranteed through the expiration date, not just at the time of manufacture. Storage conditions matter too. Some probiotics need refrigeration, while others are shelf-stable because of special manufacturing or packaging. The product should clearly explain how to store it. So before buying any Bifidobacterium longum supplement, ask these questions. What strain is it? What dose is used? Is there human research on this strain? Is the CFU guaranteed through expiration? Does the company provide quality testing? And does the product match your goal, whether that goal is digestive comfort, bowel regularity, IBS support, stress resilience, or general microbiome support? Bifidobacterium longum and gut health. The most common reason people search for Bifidobacterium longum is gut health. People want help with bloating, irregular bowel habits, digestive discomfort, IBS symptoms, or general microbiome balance. Bifidobacterium longum may support gut health in several possible ways. First, it can help create a more balanced microbial environment. Beneficial bacteria can compete with less desirable microbes for space and nutrients. They can also produce acidic compounds that help maintain a gut environment less friendly to certain unwanted organisms. Second, Bifidobacterium longum may help support short-chain fatty acid production indirectly through cross-feeding. Short-chain fatty acids, often called SCFAs, include acetate, propionate, and butyrate. These compounds are produced when gut microbes ferment dietary fibers and resistant starches. Bifidobacteria are especially associated with acetate production, and acetate can be used by other microbes to help produce butyrate. Butyrate is especially important because colon cells use it as an energy source, and it is linked with gut barrier support. Third, Bifidobacterium longum may help support the intestinal barrier. The gut barrier is the thin but powerful lining that separates the inside of your gut from the rest of your body. A healthy gut barrier helps absorb nutrients while keeping unwanted substances from crossing too easily. When people talk about leaky gut, they are usually referring to problems with barrier function, although that phrase is often oversimplified online. Fourth, Bifidobacterium longum may interact with immune cells in the gut. A large part of the immune system is located around the digestive tract. Beneficial microbes can help train immune responses so they are not too weak and not overly reactive. This is one reason scientists are interested in probiotics for immune balance, although we should avoid exaggerated claims. The key message is that Bifidobacterium longum supports gut health best when it is part of a supportive environment. If someone eats very little fiber, sleeps poorly, lives under high stress, and changes supplements constantly, the microbiome may struggle. A probiotic can be a helpful tool, but it is not the whole toolbox. Bifidobacterium longum and IBS. Irritable bowel syndrome, or IBS, is one of the biggest areas of interest for Bifidobacterium longum. IBS can involve abdominal pain, bloating, gas, constipation, diarrhea, or mixed bowel habits. It can affect quality of life and may be connected with stress, gut sensitivity, motility, immune signaling, and the gut-brain axis. Some human studies have examined specific Bifidobacterium longum strains in people with IBS. B. Longum 35624 is one of the most recognized strains in this area. Research has explored its effect on IBS, symptom severity, abdominal discomfort, and quality of life. Some studies suggest that it may help reduce symptom burden in certain IBS populations. But it is very important to say this clearly. IBS is complex. Not every person with IBS has the same triggers. Some people are more sensitive to FODMAP foods. Some have constipation predominant IBS, some have diarrhea predominant IBS, some have post-infectious IBS, some have major stress-related flares. A probiotic that helps one person may not help another. That is why probiotic expectations should be realistic. If you are trying a Bifidobacterium longum supplement for IBS, it is usually better to choose a strain that has been studied for IBS, use it consistently for the recommended period, track symptoms, and avoid changing 5 things at the same time. If you change your diet, add fiber, start a probiotic, add magnesium, and change medication all in 1 week, you will not know what helped or what caused side effects. Also, people with red flag symptoms should not self-treat. If you have blood in the stool, unexplained weight loss, fever, persistent vomiting, anemia, severe pain, symptoms that wake you at night, or a major sudden change in bowel habits, speak with a healthcare professional. For many people, Bifidobacterium longum is most interesting as part of a gentle, evidence-informed IBS support plan, appropriate medical evaluation, diet personalization, stress management, sleep improvement, and possibly a clinically studied probiotic strain. Bifidobacterium longum, mood, stress, and the gut-brain axis. One of the most fascinating areas of microbiome science is the gut-brain axis. This is the communication network between the digestive system, the nervous system, the immune system, hormones, and microbial metabolites. The gut and brain communicate in several ways. The vagus nerve sends signals between the gut and the brain. Immune molecules can influence inflammation and mood. Gut microbes can produce or influence metabolites that may affect brain function. The gut barrier and the blood-brain barrier are also part of this larger communication system. Bifidobacterium longum has attracted attention in this field because some strains have been studied as potential psychobiotics. A psychobiotic is a probiotic or microbiome-related intervention that may support mental well-being through the gut-brain axis. One well-known research area involves Bifidobacterium longum in IBS patients, where researchers looked at depression scores and brain activity. Another research area involves Bifidobacterium longum, which has been studied in relation to stress response, sleep quality, and aspects of well-being. This does not mean Bifidobacterium longum is an antidepressant. It does not mean a probiotic replaces therapy, medication, medical care, or mental health support. The right message is more balanced. Some strains of Bifidobacterium longum may influence gut-brain communication in measurable ways, and this is an exciting area of research. For YouTube viewers searching for best probiotic for anxiety, probiotic for stress, or gut-brain axis supplement, it is important to avoid hype. The microbiome may be one piece of the puzzle. But mental health is influenced by sleep, relationships, trauma, work stress, physical activity, sunlight, nutrition, genetics, medical conditions, and many other factors. A smart approach is to treat Bifidobacterium longum as a possible support tool, not as a miracle cure. If stress, anxiety, low mood, or poor sleep are affecting your life, speak with a qualified professional. And if you use probiotics, choose strain-specific products with human research whenever possible. Bifidobacterium longum and sleep. Sleep is another area where Bifidobacterium longum research is becoming popular. Many people do not connect the gut microbiome with sleep, but the relationship makes sense. Sleep affects the microbiome, and the microbiome may affect inflammation, stress hormones, metabolism, and gut-brain signaling. Bifidobacterium longum has been studied in healthy adults in relation to sleep quality and stress. Some research suggests it may have a mild supportive effect on subjective sleep quality, especially during stressful periods. This is interesting because stress and sleep often travel together. When stress increases, sleep quality often decreases. When sleep gets worse, stress resilience may drop. However, sleep studies can be tricky. Some measurements are subjective, meaning people report how they feel. Other measurements are objective, such as actigraphy or sleep lab data. Sometimes people feel better even when objective sleep measurements show only small changes. That does not make the results meaningless, but it does mean we should interpret them carefully. If someone is searching for Bifidobacterium longum for sleep, the most accurate answer is certain strains, especially B, longum 1714 have been studied for sleep-related outcomes, but probiotics should not replace sleep hygiene or medical evaluation. The basics still matter. Keep a consistent sleep schedule. Reduce bright screens before bed. Avoid large late-night meals if they trigger reflux or bloating. Get morning light. Limit caffeine later in the day. Move your body. Support your gut with fiber-rich foods. A probiotic may support the system, but it works best when the foundation is strong. Bifidobacterium longum and constipation or bowel regularity. Another common search is Bifidobacterium longum for constipation. Some strains, such as B. longum, have been studied for bowel habits, including in older adults with constipation. Constipation can have many causes: low fiber intake, dehydration, low physical activity, medication side effects, thyroid issues, gut motility problems, pelvic floor dysfunction, stress, or changes in routine. Because the causes are different, the solutions can be different too. Bifidobacterium longum may support bowel regularity by interacting with gut microbes, fermentation, stool environment, and possibly motility. But results are not guaranteed, and some people may experience gas or bloating when starting probiotics, especially if they also increase fiber quickly. A practical strategy is to start with the basics. Drink enough fluids. Increase fiber gradually, especially from foods like oats, beans, lentils, chia seeds, flaxseed, vegetables, berries, and resistant starch foods such as cooled potatoes or rice. Move daily. Keep a regular bathroom routine. Then, if needed, consider a probiotic strain studied for bowel regularity. For persistent constipation, severe pain, blood in stool, unexplained weight loss, or sudden changes, medical evaluation is important. Probiotics can be useful, but they should not hide symptoms that need attention. Bifidobacterium longum in foods and supplements. Can you get Bifidobacterium longum from food? Sometimes, but it depends on the product. Fermented foods like yogurt, kefir, and some fermented dairy products may contain bifidobacteria if they are added and listed on the label, but not every fermented food contains Bifidobacterium longum. Sauerkraut, kimchi, kombucha, and sourdough may contain beneficial microbes or fermentation products, but they do not automatically contain this specific species. If you want Bifidobacterium longum specifically, a supplement or a clearly labeled functional food is usually easier to verify. Look for the full strain name, CFU amount, expiration guarantee, storage instructions, and quality testing. Probiotic supplement labels can vary widely. Some products are very transparent, others are vague. A strong label might say something like Bifidobacterium longum with a specific CFU amount guaranteed through expiration. A weaker label might simply say proprietary probiotic blend without listing strain amounts. Also be careful with exaggerated claims. If a product says it cures IBS, fixes anxiety, melts belly fat, or detoxes the gut overnight, that is a red flag. Good probiotic marketing should be specific, realistic, and evidence-based. Bifidobacterium longum may be a valuable probiotic, but the product must be chosen carefully. The best supplement is not always the one with the biggest number on the front. The best choice is the one that matches your goal, uses a studied strain, provides a meaningful dose, and is made by a company that takes quality seriously. Safety, side effects, and who should be careful. For most healthy adults, probiotics are generally well tolerated. Some people may experience temporary gas, bloating, changes in stool, or mild digestive discomfort when starting a new probiotic. These effects often improve, but not always. Some people should be more careful. If you are severely immunocompromised, have a central venous catheter, are critically ill, recently had major surgery, have severe pancreatitis, or have a serious underlying medical condition, speak with a healthcare professional before using probiotics. Pregnant or breastfeeding individuals should also check with a healthcare provider, especially if using supplements for a specific health goal. Children should not be given probiotics casually without considering the strain, dose, age, and reason for use. Some pediatric probiotic research exists, but children are not just smaller adults. Product quality and medical guidance matter. Another safety point is antibiotic use. Many people take probiotics during antibiotics. Some probiotic strains may help reduce the risk of antibiotic-associated diarrhea, but the evidence is strain-specific and not every Bifidobacterium longum product is proven for this purpose. Timing also matters because antibiotics may kill or reduce some bacteria. A healthcare provider can help choose the right approach. Finally, remember that supplements can interact with your overall health plan. If you have IBS, inflammatory bowel disease, recurrent infections, severe constipation, chronic diarrhea, or mental health symptoms, do not rely on a probiotic alone. Use it as one part of a bigger professional plan. Common mistakes people make with Bifidobacterium longum. Mistake number 1: buying a probiotic without checking the strain. If the label does not show the strain, it is harder to connect that product with research. Mistake number 2: expecting instant results. Many probiotic studies last 4 to 8 weeks or longer. Some people feel changes quickly, but others need time, and some may not respond. Mistake number 3: using a probiotic while ignoring diet. Bifidobacteria often work better in a fiber-rich environment. If your diet is very low in plant foods, the microbiome may not have the fuel it needs. Mistake number 4: thinking more CFU always means better results. A huge CFU number does not guarantee better outcomes. Strain, quality, survival, and clinical evidence matter. Mistake number 5: confusing general gut health with disease treatment. Bifidobacterium longum may support digestive wellness, but it is not a cure for IBS, anxiety, depression, insomnia, constipation, or immune disease. Mistake number 6: changing too many things at once. If you start a probiotic, prebiotic fiber, magnesium, digestive enzymes, a new diet, and herbal supplements all in the same week, you will not know what helped or what caused side effects. The smarter approach is simple. Choose one evidence-based product, use it consistently, track symptoms, support it with diet and lifestyle, and involve a healthcare professional when symptoms are significant. Final summary: Bifidobacterium longum is one of the most important probiotic species in the human gut microbiome. It is associated with digestive health, microbiome balance, gut barrier support, immune communication, and the gut-brain axis. The most researched areas include IBS support, bowel regularity, stress response, mood-related outcomes, and sleep quality. But the key lesson is strain specificity. B. longum 35624, B. longum NCC3001, B. longum 1714, and B. longum BB536 are not just different names, they represent different strains studied in different contexts. If you are choosing a Bifidobacterium longum supplement, look for the full strain name, CFU, through expiration, clear storage instructions, quality testing, and realistic claims. Avoid products that promise miracle cures. And remember, probiotics work best when the foundation is strong. A fiber-rich diet, diverse plant foods, good sleep, stress management, movement, and medical guidance when needed. So, is Bifidobacterium longum worth knowing about? Absolutely. It is one of the most interesting probiotic species in modern gut health science. But the best results come when we respect the science, choose the right strain, and avoid the hype. Have you ever tried a Bifidobacterium longum probiotic? And what was your goal? IBS, bloating, constipation, stress, sleep, or general gut health? If you want to understand how your body really works and the benefits of probiotics, subscribe to this channel, because we turn complex scientific topics into simple and powerful information that you can actually use. And if you found this helpful, share it with someone who cares about their health.